Hey guys, it's Hink here. One of the most common questions that I get asked on the subreddit is, I don't know where to begin. All of this stuff is so overwhelming. How do I even get into enlargement? So that's what this video is for. This is basically the 101 course, the introductory level course, going everything from anatomy to the terms to actually like physiology to even through routines on basically the best enlargement practices to start out with. So if you're interested in just getting started, this video is for you. All right, guys. Hey, like I said, I'm Hink here. I'm actually a real medical doctor. I wear this mask to protect my anonymity. I get that question all the time. And so, because I talk about things like penis enlargement and the actual science and data behind it. And so, what we're going to get into today is the actual, like, a basic introductory level explanation of penile enlargement, where to start, just to give you a foundation to build upon, okay? So, let's get right into it. So the first thing we have to talk about is anatomy, okay? And so I'm going to put up some diagrams here, which you can see. And so the first thing is the corpus spongiosum, okay? Or the corpora spongiosa. That is basically the underside of the penis that leads to the glands, okay? That's all one connected channel. On either side, you have the corpus cavernosa. And so those are basically the harder level layers that inflate on either side to basically make up most of the erection, okay? You have the tunica, which is the tunica albuginea, which is the hard fibrous sheath that actually surrounds these chambers. And so on the cavernosum, it's much thicker than on the spongiosum. Sometimes there's even an absent layer of tunica on the spongiosum. That's why sometimes you can actually see more gains on the underside of your shaft and in your head because there's no tunica limiting that growth. So you also have something that's called Buck's fascia. This is commonly just completely neglected, okay? There's a superficial and a deep Buck's fascia. The superficial fascia actually comes onto your abdominal wall. Some people complain of lower abdominal pain during PE. It's because of the superficial layer of Buck's fascia. There's also the deep layer of Buck's fascia, which basically serves something very similar to the tunica. You have your dorsal vein of the penis, which is basically the most superficial vein. This commonly enlarges during PE, and people think it's a problem because they don't even realize that their dorsal vein is there in the first place. But then you also have the dorsal artery of the penis, which is deeper, and if you kind of put your thumb on that area, you can actually feel a pulse sometimes. That's the dorsal vein. And then you have your lymphatic channels. So here's an actual, basically, MRI-guided picture of the different lymphatic channels of the penis. They usually run in a like longitudinal approach, but around the glands they actually can run in like a circumferential approach, and we'll get into later why that's important. We also need to talk about abbreviations. This is a very common question that we get, and so we're going to get into it. There's a whole post here, okay? I'll try to put the link in the description if I can, but there's something called your BPFSL, that is your bone pressed. So meaning you take a ruler, you push it in all the way into your pubic bone, and then you have your flaccid F stretched length. So basically ruler in and you stretch your flaccid. This is very important for especially measuring things like progress because it's completely independent of erection quality. Tends to be that your flaccid stretch length enlarges much quicker than your actual erection length. And so you can see gains here first. Then you have your bone pressed erect length. Very similar. You get an erection as hard as you can. You press the ruler into your pelvis just above your penis and you measure what that erect length is. Then you have your non-bone pressed, okay? Your non-bone pressed erect length. And basically what that means is instead of putting the ruler all the way into your pubic bone, you basically just measure what is actually your visible penile length, okay? Then you have something that's called HF or hard flaccid. It's a medical actually cluster of symptoms or syndrome that can be unfortunately a side effect of PE if you're not careful. PE in itself stands for penis enlargement, okay? You have your PF that typically stands for pelvic floor. Then you have your MSEG. This is your mid shaft, so in the middle of basically your penis, typically your thickest point. When you have an erection, your erect girth. Then you have your EQ, short term for erection quality. Then you have ED, erectile dysfunction. Then PIED, which is pornography-induced erectile dysfunction. And then oftentimes on our subreddit r/getting bigger, you will see something that says like B 5 inches, like C 6 inches, G 7 inches. That's before. That's your current, and then that's the goal. So they're basically putting their measurements up there as far as where they started, where they're currently at, and what they hope to get to, okay? And so I'll try to insert a little username sample example there, okay? So what do you need to do before you get started? First thing you need to do is take good measurements, both flaccid and erect, okay? I'm not saying you need to take them so you can share them, but you need to take them so you can measure. Not only so you can measure for future and compare to, but also you need to understand what your normal anatomy looks like. I can't tell you how many guys contact me for injury coaching saying, oh my gosh, I have this injury, when really it was part of their normal anatomy, or it's just their dorsal vein of the penis and they think something is going on. So I'd also recommend you to actually take a video, basically doing a 360 view around your penis so you can know what your penis looks like to compare to in the future from every angle, okay? You also need to get a very good gauge of what is normal for you as far as things like nocturnal erections. How hard is your actual erection when you do get one? How hard is the actual glands of your penis? Because many people don't know this, but the actual like corpus spongiosum and glands of the penis only inflates about 75% as hard as the corpus cavernosum. Some people start off and they don't even realize that. Then they're freaking out because they think they have something called soft gland syndromes, when in actuality, the glands just doesn't get as hard as the rest of the penis. It's just the way it is. And so, in case I missed this in the anatomy, the glands is also known as the head of the penis, okay? So also before you get started, you really need to understand what the real stats are, not porn stats, not TikTok stats, what the real average is. And so there is some debate about this, but in general, guys, the average size is about 5.5 inches in length and about 4.5 inches in girth, okay? On average. So don't be fooled by porn. Yes, there's people bigger. Yes, there's people smaller, but that's the average. You should check out a site like CalcSD or Size Unravel to actually see like how 5 inches actually compares to your average woman, okay? And actually like how 5 inches compares to the rest of the population. So CalcSD is saying, if you're in a room of 1,000 people, X number of people are bigger than you. It really helps you get a better idea. You also need to understand that, here's the study here, guys. When in this study, looking at 3D models of the size that women want, it was right at about 6 inches by about 4.8 inches. So right on the upper end of average, guys. Women don't want these massive hogs, okay? And I don't care how many people in the comments are going to say, yes, they do. It's not true. It's not what the science says, okay? You also need to realize that PE or enlargement can be dangerous, okay? And so you need to make sure it's worth it to you that you are trying to enlarge it when it might not work later. I do have clients that have had permanent nerve damage as a result of permanent hard flaccid. Talk to a professional about actual penile dysmorphia. It's a form of body dysmorphia. It's real. Sometimes counseling can help. And once again, guys, women don't care about size. The vast majority of women, I just made this video here and it talks about, does size matter, guys? And it's based on this paper out of UCLA, and only 6% of women actually preferred that their partner be a different size. And of that 6%, some of them wish that their guys were smaller. So if you're a guy trying to do this for your girl, you need to understand that's not reality for the vast majority of women, okay? And then lose weight, guys. For every 20 to 50 pounds of weight loss, you can gain a ½ inch to an inch of visible length. And I can attest to this. I have recently lost about 20 pounds, most of which has been fat loss. And I look visibly much larger, guys. And here's a big hot take, guys. Realistic expectations. Yes, this works, but in 6 months, we're talking about maybe a ½ inch to a ½ inch at the most as far as length. And in girth, we're talking about maybe, 0.2 inches to maybe like 0.25 inches in girth in 6 months. And I know if you look at other people, they might say, oh yeah, you could expect much more than that. I think that that's bullcrap, or I think that they're measuring like post-pumped gains. When we're talking about just non-enhanced gains, not wearing a cock ring or anything like that, what is your actual increase going to be like? That's what I think is realistic. And I think in 1 year, you will be extremely lucky if you get to 1 inch in 1 year in length. And I think you'll be extremely lucky if you get to a ½ inch in girth in a year. So if that is not fast enough for you, that's not enough for you, do not do PE. It's not worth it, okay? But if you're willing to be patient and be dedicated and stick to it, then yes, you can make those gains and more. Also, super hot take, I have yet to see any guy that has clearly unequivocal proof of more than 1.5 inches in length, okay? And the guys that do claim that, most of the time they've been doing it for more than 3 years, okay? I've seen some guys as many as a decade in the game. These gains do not come as fast as you're going to want them to. So what are some of the fundamentals, okay? In general, girth. Is it possible to gain girth? Yes. How do we know? Well, there's actually a medical condition called megalophallus. I made a video post about it. I've also made posts on Reddit about it. It's this literal medical condition when you actually have basically either a spontaneous or through a disease like sickle cell anemia, your penis just naturally enlarges. Typically, it's not something that's like well balanced, but it's like one portion of your shaft will be 5 inches, and then you'll have another portion that just dilates due to these like chronic priapisms or erection-inducing episodes. And like there's some guys that have literally had a measured like 7 to 10 inch girth and have had to have actual reduction surgery as a result of this. So yes, this is possible to have an enlarged functioning penis. Proof of concept, period, the end, guys. End of discussion as far as girth. There's also aortic aneurysms, guys. You have your tunica intima. It's a type of tunica that lines your aorta, the major vessel that comes off of your heart. This can enlarge and expand and it can dilate, okay? The same tunica can dilate with the same blood vessels. So those are 2 proof of concept. I'm going to have a whole video coming out where I'm going to actually break down more of the actual science, like the cell stretch signaling can signal like smooth muscle enlargement, all that stuff. But for right now, that's what you need to know, okay? How about length, okay? Well, there's actually plenty of published literature like this paper looking at extenders, which show, yes, you can clearly enlarge the length of your penis by using a device that applies constant traction, okay? Like an extender. So proof of concept right there. So guys, that's going to be the end of part 1. I'm going to have part 2 coming out, which is going to touch even more in depth on basically everything you need to complete your journey. If you need to reach me, it's Doc Hink, my Patreon. That's the only place I respond to messages, guys. I have 55 clients right now, and they keep me busy enough. But stay tuned for part 2. I'm going to be releasing it shortly. And until then, I'll catch you on the next one, guys. Peace.